This is Module 3 of the Patient Safety Reporting System Training Program. In this module, we will look at root cause analyses and action plans, learn how to enter these into the system, discuss how PSRS reviews your RCA, and go over how PSRS will communicate with you regarding your RCA. This is an overview of the steps you will need to take to prepare to enter an RCA and action plan. We will go over each of these steps in detail in the following slides. The first step to enter an RCA is to log into the system. Access the Resources tab for the main menu, which will guide you to what information you will need to provide when entering your RCA. Select Event Type and view the RCA questions associated with your event type. There will be general questions and RCA-specific questions based on the type of event you reported to PSRS. All of the information you will need to enter will be shown on these screens. We will also show you how you can locate comments from the PSRS Event Reviewer. Comments can be viewed when you see a comment link in your initial event or RCA. Comments are only visible in the sections of the event RCA with PSRS comments. All communications can also be found in the communication log. When you receive the email from PSRS telling you that you need to prepare an RCA for an event, you must log back into the system to create your RCA. Once you're logged into the system, you can review the questions you will be asked before entering your RCA information. Now that you know what information you need, you will find your report. If you have your report number handy, you can type it in the Search for Report by Number box near the top of your home screen. You can also find your event by using the View Events tab on the main menu ribbon bar and click on Status Report. The Status Report page will display all of the events that have occurred at your facility, and you will be able to sort and filter by various columns so that you can easily find your event. To open your event, click on the Detail link and you will be taken to your events to start to enter your RCA. You will also find the communication log through this link. When you click on the Here link, you will be taken to the Communications log. The Communications log contains all of the comments sent to and from your facility and PSRS. Similar to entering an initial event, the main menu bar will guide you through the process. Under the main menu bar is the View Events tab where you can create reports and view your events. The Report menu bar will move you through each report section with a red arrow to indicate next steps. The RCA summary page will build as your information is entered. The Report menu will tell you what step in the process you are in for the RCA. The Save Next button will move you to the next screen and save your work as you go. The Report menu will guide you through the RCA and tell you where you are in the process of the RCA entry. A red arrow will guide you through each step of the process. You will be required to complete fields for RCA general information, RCA facts of the event, and RCA specific questions. Note that all of the fields need to be completed in order for the Save Next button to bring you to the next field. You will have a 2-hour time limit to complete your RCA before you are logged out of the system. This is a requirement of the My New Jersey network, not PSRS. Note that you will receive a pop-up screen reminding you to save your work if you are getting close to the time limit. Enter the information about the RCA and work your way through the screens. The first entry screen will be general information. All of this information is required. Note that the example given here on this screen is an insufficient description of the individuals on the RCA team. In later slides, PSRS will show you how to modify this entry to reflect best practices. This slide shows the next set of general information questions that are required. Note that all of the required information is on one screen longer than the screen of your computer, so you will need to scroll up and down to see all of the information. When you are done completing the general information section, click on the Save Next button to move to the next screen. The next screen is for facts of the event. Again, you will need to fill out all of this information completely as you can with as much detail as possible. Note that you can drag the corner of the screen downward to make the text box larger. Enter all of your facts. The additional event information field is an unlimited text field. You can use the scroll bar on the right to view all of your information. When completed, click on the Save Next button to move to the next screen. The next screen is RCA-specific questions. These questions are specific to the event that you entered. Fill in all of the information on this screen. When you're done entering all of the required information, hit the Save Next button. After you have entered all of the required RCA information, you will be directed to the root cause causality section. For each RCA, you may have more than one root cause. Each root cause will have a causality statement. There also may be more than one action plan per root cause. This would be the case if you had more than one methodology. An example would be a chart review and an observational audit. That would require more than one action plan. Once you get to the root cause causality statement screen, select one root cause. Remember, you can only work on one root cause at a time. For our example, the root cause was a care planning process that was not properly implemented. The causality statement stated that there was a lack of a specific care plan that addressed the patient's confusion, and impulsivity was a factor in why the event occurred. If you need help with the causality statement, please look to the upper right-hand corner of your screen where you will see a question mark and a link to Using the 5 Rules of Causation. When you click on that link, you will be taken to an article that explains using the 5 rules of causation, which were designed to improve the RCA process by creating minimum standards for how an investigation and the results should be documented. Once you have completed the root cause causality statement, hit the Save Next button. You will be taken to the action plan screen. Enter the first action plan for that root cause. Note that you can only select a single methodology on the screen. Multiple methodologies used must have multiple action plans. Enter all of the information for the first action plan and then click the Save Next button, which will return you to the root cause screen. When the first root cause and action plan are complete, you can add an additional action plan to the root cause or edit the first root cause. To add a new action plan, hit the plus sign on the left. This will open a new action plan link below. Then click on the Add Action Plan link. You will be taken to a new action plan entry screen where you will go through the same series of screens to enter your new action plan. Hit Save Next when complete. If you need to add an additional root cause, click on the Click to Enter an Additional Root Cause link and follow the same process you did when entering your first root cause, including adding your action plans associated with the additional root cause you are adding. When all root causes and action plans are complete, your next step will be to complete the RCA additional questions before you submit it to PSRS for review. Please note that you will receive an error message if any required information is not completed. There is a link for Continue to RCA additional questions above your root cause causality statement section. These questions are required to be answered before submission. Enter all of the information requested on the additional questions screen. And when completed, click on the Save Next button. Regarding number 5 on the additional questions, PSRS will ask you what information you consulted when preparing your RCA, such as clinical literature or other published guidelines. This information is gathered by PSRS and displayed in the system for all facilities to view. Sharing these resources among New Jersey healthcare facilities is intended to help each facility have access to best practices and share information to help improve patient safety practices throughout the state. Please note that your RCA itself will not be shared with other facilities, only the resources that you use to develop your root cause analysis and action plans. Now you are ready to submit your RCA to PSRS. Click on the Submit RCA button and your RCA will be sent to PSRS. If you want to go back and edit or review anything before submitting your RCA, you can click on any tab in the report menu to review the information you entered. Once you submit your RCA, an automated email will be sent to PSRS notifying them that an RCA has been submitted for their review. PSRS will review the RCA and communicate with you throughout the review process, much like they did during your initial event entry. If PSRS requests additional information, PSRS will send you comments and send you an email notifying you to log into the system and review the comments. Please remember that only FAC admins will be sent an email. When you receive the email notification, please log into PSRS and open the communication log for that RCA to view the email and read the contents. Comments can be accessed by a comment link in the RCA. The comment tab is only visible in sections of the RCA with PSRS comments. If you don't see a comment tab, then you don't have a comment in that section. You can also access communications through the communication log. You will respond to all comments by going back and editing the RCA. Once edited, you will resubmit the RCA to PSRS by clicking on the Submit RCA tab. Please note that there may be more than one cycle of responding to comments. The next screen will walk you through the process. When PSRS sends a communication, the FAC admins receive an email saying that comments are available on the RCA. Please log into the Patient Safety Reporting System to review the details and respond accordingly. This email will show up in your communication log with the communication type Email RCA Comment Process and display the review comments. If there is a comment on a particular section of your RCA, you can also review PSRS comments on that screen. Remember, the Comments tab will be visible to facilities only if PSRS has made a comment in that section of the RCA. Here, PSRS has made a comment on the RCA, General Information. A DOH comment screen will pop up with the message. In this case, PSRS is asking you to be more specific regarding the members of your RCA team and give their titles. Remember, you can also use your communications log to see all communications regarding your event in RCA. Click on the Here link to open your communication log for that event. Once you are in the communication log, click on the Here link to review all comments. This will open up a window where you can see all of the comments you have received. Scrolling down in this box will show you all of the comments received by your facility for this event and RCA. Newest comments are found at the bottom. You will need to go back to your RCA and edit the RCA to update your submission with the requested information. Click on the Edit button and then you will need to add the requested information. Once you have updated all of the requested information, scroll all the way down to the bottom of the screen and hit the Save Next button. Once you have provided the requested information, hit the Submit RCA tab to resubmit your edited RCA. When PSRS has accepted your RCA, FAC admins will receive an email asking you to log back into the system where you will find a communication telling you that the RCA is complete and closed. Note that PSRS may ask you for additional information or clarification even after the RCA is closed. You must log into the system to read this communication, which will be found in the communication log associated with your RCA. If PSRS asks you for more information, you can use the communication log to respond. PSRS may also ask that you upload supporting attachments to your report, which we'll cover later. Here is a sample of a communication regarding the closing of your RCA. Once your RCA is closed, the event status on your status report screen will show that your RCA is now closed. Remember from Module 2, communications from PSRS, FAC admins receive notification via email that there is a communication from PSRS. If you receive a general comment or email other, FAC admins will receive an email requesting that you log into the system to read your communications. You can also access the communications between you and PSRS through the communications log. This is an example of an email other. This is an example of an email general comment. When you send communications to PSRS, they will receive an email notification that you sent a message to them. Please be sure to send communication for the correct event number. You can send a general comment or respond to PSRS comments. You can communicate with PSRS through the communication log as shown on earlier screens. To send comments to DOH, click on the Click Here to send DOH a comment link, and you will be directed to a screen where you can send PSRS a comment. Type your comment into the box and hit Send Comment. PSRS will receive an email notifying them that you have sent a comment. Remember that PSRS is committed to helping you through the event entry and RCA process, and we are always here to help. You can also upload documents to attach to your RCA if PSRS asks you to, or if you just want to share additional information with PSRS. In order to have the ability to upload attachments, you must first contact PSRS through the communications log and ask them to enable the attachment function. Please note that you should not attach medical records. Also note that attachment titles cannot contain special characters. To add attachments to your RCA event, go to the View Events screen. When PSRS has enabled the attachment function on their end, you will see the Upload Supporting Documentation link. If you do not see this link, PSRS has not yet enabled this function, and you'll need to contact them again. To review, use the View Events menu to find your event requiring RCA or search for your event by the report number. Enter your root cause and action plan. Multiple root causes and action plans can be entered. PSRS will review your RCA and respond with the next step. Review all PSRS comments and respond accordingly. The next and final module will discuss system navigation, reports, resources, and support.